What are the risk factors for developing diabetes? Welcome to the VA DoD Virtual Diabetes Self-Management Training. Managing your diabetes. Managing your diabetes can help you stay healthy and live a longer life. Still, some people find that daily diabetes management feels like a lot to handle. Diabetes affects your routine at home, at school, at work. Does anyone want to describe some of the routine changes that they've made since their diagnosis?
I would. Tons have changed. I love chocolate. Now my wife limits me.
Did the diagnosis result in a career change for anyone?
Yes, for me, I was in active duty, but I got boarded out.
Yeah, med boarded out because of the diagnosis of diabetes?
Yes, it was affecting my work.
Yeah, change isn't always easy, but with practice, diabetes self-management can indeed become a habit. And as you get started, you're likely to have quite a few questions.
Why me?
Yeah, this is a common question. This is a common question from individuals when they're diagnosed. And so really there's quite a few factors that impact the why you question. Type 1 and type 2 diabetes do indeed have different causes, yet there are two factors that are important in both. First, there's a genetic predisposition, and then something in the environment triggers that development of type 2 diabetes. With type 2 diabetes, there is indeed a strong link to family history. The majority of clues really comes from actually our Native American Indians. About 85% of Native American Indians that are in the Pima Indian tribe of Arizona develop diabetes before the age of 55. The genetics of diabetes is extremely complex. Colonel Rogers, is there any family history of diabetes in your history?
Yes. My father and his father before him, and now me.
Oh my goodness, yeah. If either your mother or your father has the diagnosis of diabetes, your risk increases by 10 to 15%. If both parents have diabetes, the risk increases by 75%. If you have an identical twin with type 2 diabetes, your risk increases 90%. Your genetics are identical, but your diet, activity, and environment are different, telling us environment has had an impact. Native American Indians and Alaskans have the highest ethnic risk. African Americans are about twice as likely as non-Hispanic whites to develop diabetes. As we look at the risk factor, body weight, obesity, this tends to run in families, but again, when you have extra body weight, this is indeed a risk factor for developing type 2 diabetes. Lifestyle. Lifestyle matters. Colonel Rogers, are you physically active?
Probably not enough. Not enough.
Yeah.
I need more. I know I've heard the walks after meals are there and helpful and can change numbers, but I just need to make the changes I know I need to make.
Colonel Rogers, do you use a pedometer?
No, I don't. I don't have one. Is that the thing that like counts your steps or something?
Yes. We will get one ordered for you and send that to you in the mail.
Wow. Thank you.
Of course. It's very, very important to really take a look at that lifestyle. How many steps are you taking in an average day? And then we're going to take a deeper dive into lifestyle during our physical activity class. So this actually takes a deeper look at the natural history of type 2 diabetes. Oftentimes we worry about prediabetes. And on this particular slide, we're looking at the 15 years before somebody is diagnosed with diabetes, all the way up to that day of diagnosis, and then the next 30 years after that. And the very first line that we see on the surface is that orange line, your post-meal blood sugar values. We see there's an increase in after-meal blood glucoses about 5 to 7 years before diabetes is diagnosed. Next, the light blue line. That blue line slowly increases. That's the fasting blood sugar, the fasting glucose. And it crosses the diagnostic line when that is above 126. Under the surface, what's going on metabolically? Look at that navy line. That navy blue line is a measure of insulin resistance. And we see this insulin resistance beginning up to 15 years before you are diagnosed with diabetes. As the body becomes more resistant to the insulin that you're producing, your body actually responds by increasing the amount of insulin that it makes. That's the red line. So your body begins to increase how much insulin it's making. Those beta cells, they live in the pancreas, and those beta cells are being asked to work harder and harder. But those beta cells are slowly dying off. And at the point of diagnosis, you've lost about half of those cells that actually make insulin. So a question is, how can we save those beta cells? And that's why we begin with prediabetes. If we find that somebody has prediabetes, we want to save those beta cells. And we typically focus on weight loss. Diabetes is a chronic, lifelong condition. Type 2 diabetes is the most common form of diabetes. Glucose is a sugar that is made in the body after food is broken down and digested. It is our body's main source of fuel, our main source of energy. You eat a meal, and your stomach begins to break down that meal, and some of that food is turned into glucose. Glucose is then absorbed into the bloodstream, and there is that green line again. The beta cells make that insulin, and that insulin enters your bloodstream and acts like a key to let that glucose enter your cells. And remember, glucose is fuel, glucose is gasoline. Food contains sugar, and that sugar is broken down, and the glucose is your energy. Our brain, our muscles, and our internal organs all use sugar or glucose as fuel. What is diabetes? What types of diabetes exist? Well, there's different types of diabetes. We have type 1 diabetes. This is actually an autoimmune type of diabetes where the body's own immune system kind of goes a little bit berserk, and it often begins in childhood, but there are many adults that develop type 1 diabetes. Type 2 diabetes is typically what we see in adults, but again, we are seeing younger people developing type 2 diabetes. In individuals with type 2 diabetes, beta cells retire. At the time of diagnosis, about 50% of your beta cells have retired, and by 10 years, almost all of them have retired. Many individuals with type 2 diabetes eventually require insulin injections. And at this point, let's watch a video demonstrating how glucose gets into the cells and why insulin is important.
Is made in the pancreas, which is located behind the stomach. Clusters of cells inside the pancreas called islets contain beta cells. It is these beta cells that make the insulin and release it into the blood. In addition to helping cells absorb glucose, insulin also stimulates liver and muscle tissue to store excess glucose called glycogen.
Insulin unlocks the cells. Every cell has a keyhole or a receptor site, and the key needs to be placed into that receptor site to allow the glucose to enter. What is insulin resistance? Think of insulin resistance as having that receptor site clogged. Somebody has put gum in that keyhole. And if someone were to put gum in the keyhole of your home, even if you had the key, it wouldn't work quite right. There are certain medications that can help clean that keyhole. Physical activity, weight loss, diet, all matter when you are resistant to insulin. Often individuals with the diagnosis of diabetes say they are very tired. Now think about riding a bicycle on a nice, smooth sidewalk. There's really no resistance and pedaling is easy. Now let's think about riding that bike in sand. When we ride the bike off of the sidewalk and into sand, the wheels sink because there's a lot of resistance and you can feel quite fatigued. Colonel Rogers, do you have any questions at this point about risk factors for diabetes or what is going on metabolically when you're diagnosed with diabetes?
I would say that I feel a lot better about my diagnosis, that there's something I can do about it to help myself. And I have some strategies that I'm learning here. I don't have additional questions, but I'm eager to learn more.
Thank you much. If you enjoyed this presentation, please join us in the Virtual Medical Center the second or third Thursday of the month from noon to 2 p.m. Eastern Time for a live class. Thank you for making your health a priority. I hope to see you soon in the Virtual Medical Center.